right about now. Also tweet at Trevor Mbija at Citizen TV Kenya. Use the hashtag Monday Report. Dr. Peter Kamunyo is here. He's the CEO of NHIF. Dr. Thank you for making time. The one question that I've heard from so many people is, why doesn't NHIF cover COVID-19?
Thank you, Trevor, for having me on the show today. And as you know, NHIF, in terms of its coverage, does not discriminate against age or illnesses. And it's also good to know or understand that NHIF is an insurance fund, meaning that we get contributions from members, which is like the premium, for a certain defined set of benefits. And that is a promise that we give all Kenyans in terms of what they will get when they pay, if it is for the voluntary contributors, 6,000 annually or 500 shillings per month, and for the others, the benefits that you get. Now, one of the key exclusions for many insurance companies, actually almost all, is pandemics. And COVID being a pandemic presents a specific challenge that, number one, we do not know the extent. Number two, we do not know the duration. Number three, even the management of it. So if you look at from the insurance point of view, when a pandemic is declared, and that is usually declared by WHO, so the whole world goes into a mode of managing that. And for many insurance companies, you'd see in their treaties, that is not covered. And if I take you back like the period of Ebola, because it was widespread, we can even decimate the one promise that we provide, that is the healthcare institutions, that to an extent that you cannot provide that service. So when we have a scenario where we're in a pandemic and we have not yet been able to model what the impact will be in terms of treatment and management and also cost, then you find that as an exclusion. However, if you recall back, like when HIV first hit and it was declared a pandemic, almost no one was covering it then. But after we learned about how the disease is managed, the financial modeling was done, and now we do not discriminate against that, and we actually pay like many other insurance companies as well. So as we get to be able to do the financial model, we'll be able to see how to ensure that it is covered. But as you know, the government is taking great measures to ensure that facilities are available to ensure that our Kenyans are able to access care. Hospitals.
Dr. Kamunyo, now that it's already here with us and we know the Delta variant is even more virulent, does it mean, what are the time frames that we're looking at in this case? How soon will you get the models and then cover it?
Trevor, that's an interesting question, and that is the challenge with pandemics as well, that you cannot predict until you have enough history to be able to do the modeling. You cannot predict. Like now with the Delta variant, and we know, as you've heard also in your reports, that it's even more virulent, and it's affecting more people. It's running its course a lot faster. So these are challenges that we will keep to learn. But as we move along, and even as we get to maybe even the state of UHC, whereby all members are contributing, then in such a situation, you're able to spread that risk to an extent that you'll be able to cover. But it's good to note that in cases of a pandemic, there are those challenges of, if the healthcare system, for example, is decimated, as had happened way back when we had Ebola, then it can present a challenge.
Okay. Stay with me. Let me bring up the questions that have been asked by most of our viewers this evening. Let's bring up the first video question.
Yes.
Dr. Kimani Kamau, and I am a dentist working at Kenyatta National Hospital. I want to advocate for further expansion of oral healthcare under NHIF so that more citizens can be able to access dental treatment, especially in public hospitals.
Oral healthcare expansion, Dr.
Yes. We are definitely looking at expanding the coverage that we have to all Kenyans, so that, like in the spirit of UHC, is ensuring that all Kenyans have access to the healthcare that they need without financial hardship. And I like that point that Daktari has raised, that especially in public hospitals. So that challenge would also be thrown back, especially to the county hospitals, to increase the capacity as well of these hospitals to be able to handle these conditions, and to also increase the capacity to ensure that the citizens can also be able to access these services once they are also expanded in our national health scheme.
Okay, let's bring up another question.
What is the essence of hospital selection for outpatient patients? Number 2, why does the NHIF, which we pay 500 every month, does not cover for tests like colonoscopy, which are very expensive for the common man to afford?
Daktari?
Yeah, great questions there. In 2015, when the premiums were increased slightly, some of the benefits that we included into what we are calling now the super cover, one of them was outpatient cover. And then also other packages, about a raft of about 10 packages that included surgical package, oncology package, road rescue, kidney care, etc. Now, for the national scheme for outpatient, one of the key challenges with the outpatient is that it's extremely voluminous. For example, we see almost 600 to 700,000 outpatient visits every month. Now, in terms of being able to reimburse, to be able to pay for outpatient, because of this high volume, having like the claims, daily claims becomes a challenge. So the model that we use to pay for outpatient is what we call capitation. And with capitation, what we do is that we encourage our members to select an outpatient facility that is easily accessible to them and that meets their standards. Now, once they select, and this selection since last year in May, you can do it through your mobile device, whether it's a smartphone or a analog phone through *155#, and you select your facility. Now, once you select the facility, we collate all those people who have chosen a certain facility, and we pay that facility in advance. And that's what we call capitation fee. And that is why it is important to select your facility so that you're able to access care there. Now, for inpatient, you can be able to access any of about 8,000 facilities across the country. So there is no limitation as to where you can go for inpatient care in the country. Now, the second part of the question about colonoscopy. Colonoscopy is actually covered, and so are many other interventions, including even more recently the PET scans in terms of advanced imaging in detection of cancer. And with colonoscopy as well, within our surgical packages, from minor surgery to major surgery, and even up to specialized treatment, is indeed covered.
Yeah. But
for some of these benefits, when they get to the hospital does send a request for pre-authorization, and then our team of case managers do pre-authorize for that care. So the hospital that you get to, they need to request for authorization, but the hospital must have been contracted to provide that service.
But actually, what happens if you select a hospital and then you fall sick somewhere else? I mean, if you can't access that same hospital that you selected, then what happens?
Right, and that is, Trevor, that is a common question that we get, and one of the frequently asked questions. And should you be somewhere and you need that outpatient care as an emergency, and you're not, it's not a facility that you're chosen, by calling any of our care numbers, you'd be able to get pre-authorization to have that care there. But if it is an emergency that requires outpatient, then any of the 8,000 hospitals you'd be able to access.
Okay, let's bring up another question.
I feel I'm inadequately covered on NHIF simply because you walk into a private health facility, then they tell you the systems are down on the side of NHIF. So how, when you go to seek medication, how will you tell actually that is the reason they are telling you? So it is high time the CEO looks into the private facilities. If they don't want to accept Kenyans using an NHIF card, it is high time they just drop from the game.
Daktari, systems downtime, especially in private facilities.
Yeah. Trevor, you know, and great question as well. You know, to be able to achieve universal health coverage, where every Kenyan has that access, we do need the interplay between public hospitals and also the private hospitals. And in terms of our distribution, over 5,000 of the hospitals we have on our panel are actually public hospitals, and slightly over 2,000 for the private hospitals. Now, the issue of connectivity is something that happens occasionally, and is something that we are working together with the institutions, together with the healthcare providers, to be able to eliminate. But one thing that I would urge, and that is why we enhanced our customer care center to be able to provide real-time and those systems are down. You can always check with our customer care center, with our customer experience center, and if the systems are down, you'd probably be advised to wait, or other facilities that are nearby there, you'd be advised to go to where the system is working. So the key thing is to ensure that you do get feedback from our able customer experience officers, as well as our case managers, who are always available to help.
Yeah. Daktari, what is your payment policy of settling bills by NHIF? Because there are some private facilities that avoid that deliberately because you don't pay your bills, Daktari.
We do pay our bills. If you even go by our last financial year, we paid almost 54 billion out of the 61 that we collected out to the providers. So we do pay bills. And in terms of the contract stipulates that we pay the bills at least within 90 days. But indeed, you realize with the high volume of transactions, there are bound to be issues to do with reconciliations. There are bound to be issues with incomplete documentation, and sometimes even suspected malpractice or fraudulent claims. So there is some process of education that does go through to ensure that we are paying the right claim for the right person and the right amounts. And we are endeavoring that. Actually, for clean claims in the last 1 year, the turnaround time was actually 17 days for the payment. So we are really working hard to ensure that we reimburse our key collaborators, actually our key stakeholders who are the providers. But also, I know there was a challenge for some time. There were some delayed payments for certain programs that require funding from third party or from National Treasury. That's delayed a bit. And as soon as those funds were made available, I'm sure the hospitals would attest to the payment.
Yeah. Daktari, are you aware of any corruption claims from your side? Because I was speaking to a health practitioner who did not want to be named, but he said that there are those who are telling him from your office that if he's owed 67 million, he's actually owed 67 million shillings, that if he gives back like 5 million, then his money will be processed.
Med is a very complex issue, and it tends to involve almost all the players. It involves patients, it involves providers, and even sometimes the employees of the fund or an insurance company for that matter, because medical fraud has been estimated globally to be in the region of 20 to 30%. And we know that collusion to defraud is something that is there. And this is one of the key areas that we are addressing as a fund in terms of the reforms to ensure we, if not to eliminate, drastically reduce. And to be able to do this, some of the measures that we've actually taken is, number one, introduction of the e-claim. So to ensure that the claims that are made by the hospitals are recorded in real time and in the correct form. So even the providers now would be able to be paid more efficiently and faster because the record is there and there's no need to have a third party who is trying to explain that if you do this, I will do that.
Okay.
Everything will be digital. Yeah.
All right.
And
Thanks.
then the thing is that we have also taken stringent measures to ensure that we bring to book all those, including staff who are caught with any fraudulent activities. In fact, just last week, we also let out a circular in the media that if anyone asks for any funds, to report. So these are measures that we are taking to reduce, because we know the temptations to take advantage of situations does exist, and not just at the fund, but in many areas as well.
All right, Daktari, stay with me. We're taking a quick break here. When we come back, we'll take the phone calls and a few more questions. I see them on Twitter. Use the hashtag Monday Reporter Trevor Mbija at Citizen TV Kenya. We're back in just a moment. All right.